into September, right? The fall is almost here. We got college football. We got kids going back to school. We also have Prostate Cancer Awareness Month. So, guys, there are some things you need to know. We've made it very simple. 3 things. Dr. Michael Lutz from the Michigan Institute of Urology. Dr. Lutz, the first thing is know your numbers. What number are you talking about?
Your prostatic specific antigen. It's
the PSA.
Yeah, it's really important. I know PSA was first discovered in 1979, but it's a real game changer because it's something simple. It's just a blood test. And if you get this blood test, you know, knowledge is power. And so if you go and get your blood test, you know your numbers, you know your risks. If your PSA is below 2, you're probably at low risk. But if it gets above 2 and or is rising, you should seek attention and get some expert advice.
All right, know your numbers. Number 2, know your risk factors. Certain guys are more at risk than others.
Yeah, if you have a family history, you know, you got to pick your parents carefully. Well, in this case, it's really important. If you have a first-degree relative with prostate cancer, you have a 2-fold increased risk. If you have 2 family members, you have a 4-fold increased risk. Those are really important risk factors. Also, if you're a man of African American descent, increased risk for prostate cancer, higher risk of getting it, having a higher grade of disease, and a higher risk of dying from it. So you really need to be cautious.
All right, so you know your numbers, you know your risk factor, and know this, guys, you're not going to feel any symptoms. Don't say, I feel fine, there's no way I have prostate cancer, because you're not going to know if you have it usually, right?
Yeah, if you wait for urinary symptoms to occur, it's probably going to be too late. Most times, if not all the time, this is an asymptomatic disease. We find it in men who have no idea, and we have to convince them that we are now finding something significant. So don't wait for symptoms. Just get checked if you think you're at risk.
All right. And at what age, doctor, do you start with the PSA test?
In general, we start around age 50, but if you have a family history or a risk factor, you should probably start at age 40.
All right. So that was actually 4 things, but we can remember all that, right, guys? Thank you, Dr. Lutz. All right, something to start thinking about during the month of September and beyond. That's HealthWorks. I'm Dina Centofanti.